The skull is a complex structure composed of 22 bones which are divided into two main groups. Cranial bones enclose and protect the brain. They include the frontal bone, which forms the forehead and part of the eye orbits. Parietal bones, 2 in number, form the sides and top of the skull. The occipital bone forms the back of the skull and houses the foramen magnum, the opening for the spinal cord. Temporal bones, also 2, are located on the sides of the skull and house the organs of hearing and balance. The sphenoid bone is a complex bone shaped like a bat, forming part of the base of the skull, eye orbits, and sides of the skull. Lastly, the ethmoid bone, located in front of the sphenoid, forms part of the eye orbits, nasal cavity, and roof of the mouth. Facial bones form the framework of the face. They include nasal bones, 2 in number, form the bridge of the nose. Maxillae, also 2, are the upper jaw bones containing the upper teeth sockets. Zygomatic bones, or cheekbones, again 2. Lacrimal bones, 2 small bones forming part of the eye orbits. Inferior nasal conchae, 2 curved bones within the nasal cavity. The vomer forms the lower part of the nasal septum. And the mandible, the lower jawbone, is the only movable bone in the skull. Important features of the skull include sutures, which are immovable joints between the skull bones, fontanelles, the soft spots on a baby's skull that allow for brain growth, and sinuses, air-filled cavities within some skull bones that help to lighten the skull and warm and humidify air. Would you like to learn more about a specific part of the skull or its functions?